Aaron's first diagnosis was made by Michael DeBaun when he was a hematology oncology fellow at Children's Hospital in 1990. And he said very clearly, your son has a sickle cell disease. He was nothing short of life-saving in that instance. Caring for our son, bringing exactly what was needed to bear, and he has been our hero ever since.
Focusing on sickle cell disease was an easy decision for me. I wanted to become a physician so I could serve others, and particularly others who came from my community. And I wanted to have an impact, and I wanted to advance the care. I grew up in St. Louis. My mom was an elementary school teacher, and she was a teacher for students with special educational needs. My dad was a factory worker. When I grew up, I had a tremendous amount of admiration and respect for my pediatrician. Her name was Helen Nash, and I just admired her grit and her focus on serving the community. That was the type of doctor I had wanted to become. My dad worked 3 jobs to make sure that we could go to the schools that best fit our choices. And I had a range of schools to apply to, but I got a full scholarship to go to Howard. It was a unique environment. It's a historical Black school. And really the first time since elementary school, I was in an environment where my color didn't matter. Showing up on the campus of Stanford during my interview, it was just so foreign to what I had been exposed to. And so I didn't really see anybody who was like me. And I was turned off. And I told my dad, I don't think I want to go. And my dad, even though he was on a factory worker's salary, said, look, just go back for me. And the second time I met students who were similar to me in background, and I started to really see the approach to the medical education that I embraced, which was very individualistic. It was very focused on like a grad school approach to medical school. And for me, that was critical, and it launched my career. Dr. Bert Glader and Stan Schreier were 2 of the pediatric and adult hematologists that I admired the most, and they had a big impact on helping me understand the role of being a complete physician in providing care for others. My education at Stanford was challenging. I loved the challenge. I loved the intellectual entrepreneurship that was really the underlying spirit of Stanford Medical School, and I have carried that spirit with me to this day. So after I finished Stanford Medical School, I went to St. Louis. We went back home, and Malcolm was born there, and our daughter Morgan was born there. I was a resident in pediatrics at Washington University, St. Louis Children's Hospital, and then went on to become a hematology oncology fellow there, and then went on to become a chief resident. And after 5 years of clinical training, I decided that wasn't enough. I wanted to be a world-class investigator focused on sickle cell disease.
The advances that have been made in sickle cell disease in the United States are really tremendous. It hasn't been so many years ago that the lifespan of these patients was 25 years. Now it's over 40. Michael, throughout all of this caring increase in therapy, has been at the center of this over the years, and it's just remarkable.
I really have been focused on understanding the impact of strokes and then of silent strokes. And so children go often undiagnosed, yet they still have significant cognitive deficits. And in fact, we were able to show that in the New England Journal of Medicine that demonstrated that children who had silent strokes and were treated with regular blood transfusions when compared to not treated with regular blood transfusions had about a 60% reduction in the rate of progression.
Dr. DeBaun is my mentor and has been since I first matched for my pediatric hematology oncology fellowship at Vanderbilt. And he has been pretty much instrumental in my career in every step I've made since I first met him. And he said that as a sickle cell researcher, you really can't do anything meaningful or impactful or call yourself a sickle cell researcher unless you're doing something in Africa.
There's really a tale of two cities in sickle cell disease. In the United States, 1,300 children are born with sickle cell anemia a year. In Nigeria, 150,000 children are born with sickle cell anemia a year.
In his work in Nigeria, there was a problem with many of the women dying giving childbirth, up to 10%. And so a caring physician can develop a treatment paradigm that looks after these women and is able to prevent death. And so that can be reduced down to 1%. And so it's just a remarkable accomplishment. And there are data in his trials that substantiate that.
Michael DeBaun was the first person to talk with me about medically supervised summer camps for children with sickle cell disease.
As the clinical director for the Division of Hematology Oncology, I had access to a half a dozen camps for children with cancer, and not a single camp for children with sickle cell disease. And so that disparity was so clear, and it was biting.
It can make all of the difference in the world in the life of a child with sickle cell disease. You go to that camp and you're in the middle of a community of other children, and all of a sudden you feel, I am alike. There are others like me. His advocacy has been for access. The Sickle Cell Act of 2004, which brought into existence regional sickle cell centers so that they are available. He's changed medicine. There's no question about it. And he's changed it in ways that make a difference to a mother and a father and a child. As a mother, the most difficult part for me in the journey with Aaron of him having sickle cell disease is I couldn't fix it. Can't make it go away. And he told me one day, Mom, I can't beat this thing. No matter what I do, I can't beat it. And talking about curing this disease was not a topic of conversation during the course of my son's lifetime. But it is now. And that's exciting because you have a world-class physician scientist, and he chooses to be committed to advancements in the area of treatment and the cure of sickle cell disease.
I think Dr. DeBaun is deserving of the Sterling Award, and probably the most deserving person I can imagine, just because of his ability to transform so many fields of medicine in general. He has done so much in global health, in advocacy, in patient care, and I just can't imagine anybody more deserving of a Lifetime Achievement Award like the Sterling Award.
I was overwhelming to receive the Sterling Award. It's really a tribute to my family, my wife, who's endured endless days and nights of me focusing on my work and allowing my mentees to be part of my family, and my two adult children who literally as children all they knew was Dad working. It's a moment of reflection, and I'm deeply honored to receive this award.